Well, that previous story there by our very own Kenneth Kazungu is the reason why I'm joined in studio by Emma Karitu, who's a counseling psychologist, and Biko Omangula, who survived depression. Welcome to the studio.
Thank you.
800,000 people globally every year. That's quite worrying.
It's very high.
It's very high. That means one person in about 40 seconds?
In about 40 seconds. We lose a person due to suicide. Yes.
And, you know, I was looking at the statistics, and there's a lot that is not said about suicide, especially in African countries. It is regarded as a taboo, and it is underreported, number one, and then it's talked about in harsh tones. But there are a lot of misconceptions about suicide. Is it true that people who commit suicide actually show indications that they might actually take their own lives?
Yeah, actually what happens with suicide, they will give some signs. But if somebody is not keen, you'll not be able to tell. So it's very important that people, because what causes suicide is basically mental illness. It could also be issues in life, the pressures of life, like maybe financial crises, relationships, loss, even loss through whatever kind of loss of a job, loss through death. It causes, it can lead to suicide. But before it gets there, somebody goes into depression. So it is very important for people to know the symptoms of depression so that you're able to tell this person is planning or attempting to commit suicide. Yeah.
I'll go to you, Biko. You have survived depression. Now you're an entrepreneur and you raise awareness about depression. Kindly, from where you sit, what are the telltale signs probably from someone who's survived or who's going through depression to the point that they might actually think of taking their own lives?
One of the telltale signs is that you'll find that an individual maybe who was very outgoing for some reason changes and withdraws from interacting with people. Another telltale sign is they might actually state that they want to commit suicide,
Yeah.
And it's a trend that we've been seeing on Facebook, like people are going, they post on their wall that I'm tired of this life. Such kind of telltale signs are, very worrying. So they can actually indicate that somebody is actually thinking of, ending their life. Yes.
And because it's now talked about, and since the advent of social media, and the world has become smaller, as you say, I've seen such cases where people post, a message before they take their own lives. What measures can be taken? Because in social media you also expect jokers. So what measures or what can be done to avert such?
For one, maybe if you see your friend has posted such kind of a message, it would be good for you to reach out to them. If you have the number, try and call them to find out what the issue is. Because at times, just like you said, it might be a prank that somebody is trying to pull. But most of the times, when you actually see somebody has gone and posted that on their Facebook wall, it's something to worry about. So you need to reach out to your friend, and just find out what's going on with them. Yes.
So coming back to you, Ms. Emma, is it true that people who want to take their lives will do it either way, irrespective of what you tell them, they'll still find a way?
Not necessarily. It depends on the level of depression that someone has reached. If they get help in good time, they don't actually actualize the same. So it depends on the level of where they've reached, and also are they getting support? Are they addressing the issue? Are they seeking treatment? Are they, are they getting support from their family? Are they seeing a specialist? For example, they can go for therapy. They can join a support group. So it depends. Yeah.
Okay, one of the cases probably that you've handled as a psychologist,
Yes.
and one that you probably use as an example when you handle your other patients, kindly share with us an experience that probably could help someone out there.
When it comes to the client, we refer to them as clients. We don't call them patients.
Oh, yeah.
Patients are in hospital.
Sorry for that.
So we refer to them as clients. So when these clients seek help, sometimes they don't seek help, but you can get a call from somebody, like a referral. Maybe like maybe in an organization, somebody has realized this staff, there's something wrong with this staff and they need to be sent for counseling. So when they come, that is when you're able to at least talk to them, yeah, and get to understand what is the underlying factor that is causing them to want to attempt suicide. So when you're able to dig in, they can get help in good time. Yeah. So for example, there's a case that I heard of, it was a student, and the parents couldn't understand what was going on. But it was a bully, it was a social media bully. And this girl just changed from the way she was behaving. She lost interest in activities she used to do. Her eating, she had lost weight. What we normally, one of the diagnosis tools that we use, we check for the last 2 weeks, has somebody had these symptoms. So when you're able to identify like loss of weight, losing interest in activities that somebody used to enjoy, and then lack of sleep, and then the most important thing is that they normally say, but people don't take it seriously. Like somebody can say, "Mimi nitajiua," but most of the time people just brush it off, not understanding, like in the case of a teenager, as the statistics have shown, the most affected people are between ages of 15 and 29. So for a teenager, the parents will just ignore them, or even the teachers. But when they actually actualize when they actually commit suicide is when they say, actually she had said she'll kill herself. So what I would caution people is that you need to be able to, we need to be alert, because what is happening in the society, people are so busy. We are so busy with work, we are so busy with businesses that we don't really care about what is going on. Especially, let me talk as a parent, what is going on in our children's lives, what is going on in our spouse's life, what is going on, with family members. We are too busy, and that we don't get time to check. So I was talking about the ages 15 to 29. These ages are the ones who are at high risk because their developmental stages. You see, when a teenager, when you look at a teenage young man or a young lady, you will think this is a mature person because their physical growth is showing, but in real sense, their brain is not fully developed, because what happens, the brain develops slowly up to age 30. So for a teenager, maybe going through issues of pressure, maybe pressure with performance. Actually, we've been seeing a lot of people, you'd wonder, why should somebody commit suicide because they've not attained 400 marks? You see, to you as a grown-up, you're like, why should you kill yourself? But that is pressure to perform, or pressure with relationships, maybe with the parents, relationship with their peers. So because they use, what is more developed for teenagers is the emotional part of the brain, the back of the brain, which is the emotional part, but the intellectual part, the front part of the prefrontal cortex, the front part of the brain, which is in charge of decision making, making cognitive thinking. That one is not fully developed. So that is why they end up doing some things that you'd wonder, why are they doing it? But because that knowledge is not there, there's a communication breakdown between the adults and the teenagers. So what I would urge people out there is to understand how the growth of the teenagers, how the developmental stages of teenagers are, as opposed to the adults, so that we're able to understand they're in this stage, so we need to listen to them more. We need to listen to them more so that we're able to help them. Yes.
Before I go to Biko, there's a thinking, and you'll tell us if it's a misconception or not, that the tendency towards suicide runs from a generation to a generation. Some people think that it is actually inherited. What do you think about that?
Actually, it is true, but not for everybody. There's something in psychology that we call a genogram. So normally when we get a case of somebody who is attempting to commit suicide, we normally do a genogram for them, because it's also genetic. Okay. So when you draw your genogram up to the 3rd generation, and you're able to pick that there's been suicide cases in the family. It's not all families, but it's just like alcohol. If your family is predisposition to alcohol, then you are most likely to become a drunkard. So the same case with suicide. If you have a history, if your family history through your family tree, let me use a layman's language instead of talking about the genogram. If your family tree, there are suicide cases, you're most likely to attempt suicide than a person who does not come from a family that has past suicidal cases. So yes, it is true.
Okay.
Yes.
So, Biko, is it true that people who want to commit suicide would less likely talk about it, or they are more likely to talk about it?
It depends on the level they're at, because in the beginning, they will talk about the issue. They will mention it to their friends or their families. But if maybe the family members don't take it seriously now, they will automatically withdraw. Yes.
So, would you want to probably share your experience with us? Just, not really the details, but what you probably were going through at a time when you had such thoughts.
Okay. I was about 19 years. I had just completed high school, so I was waiting to join university. And while you're waiting to join university, you're just at home. So I wasn't really engaged in any form of activity. So in that process, I also decided maybe I can try to look for a job in the meantime, before I joined campus. But when I went out, looking for work, I realized that I don't have any qualifications, see? And also, there was also an aspect of finances. They weren't there, readily available. So in that process, you start asking yourself, so what do I do here? So in the process, you start becoming frustrated. Then you start having, negative thoughts like, I'm seeing my peers are going to university. Well, I'm still here, sitting at home. So what will happen? So you start having negative thoughts. In the process, you lose hope. You lose hope in life. Then in the midst of that, maybe you've tried to reach out to people and, they seem not to care, quote unquote. Like myself, I just somehow withdrew. Then I started having negative thoughts. And that's how I ended up into depression.
Okay.
Yes. Lucky enough, I reached out to a friend of mine. There's a very good friend of mine. We've been friends since way back. He's called Michael. So what I would do, I would actually find time to talk to him. He had a listening ear. We'd talk to him about the issues that I'm going through. I also had a friend of mine who owned a pharmacy, so I'd also go there. So that was a form of therapy for me, yes.
Yeah.
And lucky enough also, I didn't take any medication. So for me, it was just, talk therapy and reading inspirational books. And, before depression, I used to do certain activities. So during the depression, I stopped doing anything. So I also started doing whatever I had previously been doing. So in that process, I started regaining myself and I started becoming better. And that's how I came out of the depression.
Well, let me just take you back. You said it was lucky for you not to take medication. What do you mean by that?
In most cases, individuals who suffer from depression, depending on the severity of the case, there are various options. There's the therapy, and then there's also medication. For some reasons, I didn't take medication. I had spoken to the issue to my parents, and I think they didn't want me to take medications, because there's also another negative side to medication, because somehow you might end up being addicted to medication. Yes.
Well, Emma, just before we wrap up, suicide, as I said, in Africa is regarded by some as a taboo. And some people who've attempted suicide unsuccessfully, they find themselves on the wrong side of the law. And this is a psychological issue. I know, you know that from where you sit.
Yes.
Do you think we should come up probably with friendly laws and maybe increase awareness in the society so that, such people, instead of, throwing them behind bars, because even behind bars, they can still find their way. Do you think that we should do more probably to raise an awareness about this issue?
Oh yes, definitely I agree with you. Because you see, suicide, depression, or rather mental illness, is a disease. And by the time somebody gets to that level and they haven't gotten help, they actually attempt. So when they don't succeed, it is not right to like outcast them, something like that, yeah, because it is a disease. So I think we need, maybe through the media, through schools, through the clergy, maybe the church, through parents, we need to raise an awareness. And as Biko was talking about why he didn't take medication, it is because for depression there are certain levels. We have mild, which is caused by the daily stresses of life. Then we have the moderate. So when it gets to severe is when you can actually get be put on medication. So if somebody was already on the severe state and they end up attempting, it is very wrong for us as a community to crucify them. Actually, they need help. I know the law says that your life belongs to, it is not your life belongs to the government and all that. But when it is a disease, it is not right to condemn them. And I think, yeah, as you're saying, maybe you should develop patients' rights so that, you know, if somebody is suffering from mental illness, they should not be victims of circumstances, because we have failed as a society of not, we've failed of not creating awareness. So the more awareness we create, the more such people can get help. And also, of course, in our African culture, people don't talk about it at all. Like we lost my husband's friend lost his wife through suicide. And when I went for the funeral, no one was talking. It was like, you know, it's a taboo. It's a taboo. You don't even talk about it. You don't want to discuss about it. It is like, we can't. So I think we need to outgrow our culture and look at it from a medical angle and see how we can help these people.
Okay, well, for someone probably sitting back at home and watching this, how can they reach you?
Actually, they can call me on my mobile, which is 0720 81 7718. Yes.
Will you repeat it kindly for us?
0720 81 7718.
Well, Biko, you're also an entrepreneur and you create awareness on depression. How will someone reach you if they wanted to?
I have a Facebook page. It's called Safe Hands. So somebody can inbox me through there. And they can also, you know, somebody can also get in touch with me through my mobile number. Yes.
Which is?
0720 840 522.
Well, 0720-840-522. Thank you so much, Biko. Thank you so much, Emma, for coming to discuss this topic that is less discussed, especially in our African society.
Yes.